It's a sweltering Friday afternoon in Washington, D.C. in July 2009. The President's healthcare team is meeting on the second floor of the West Wing. I'm there. Gene Sperling from Treasury's there. Peter Orszag, the Director of the Office of Management and Budget, is there. Nancy Ann DeParo, the President's healthcare reform leader. Jason Furman and Bob Kocher from the National Economic Council are sitting there. And Phil Shalero, the head of legislative affairs, is there. We're talking intensely, and the President walks in, mainly for a pep talk to keep our energy and spirits up during the hard summer months of healthcare reform. But soon we turn from pleasantries to substance, and we talk about a contentious issue on healthcare reform, the tax exclusion, and whether to modify it in the Affordable Care Act. What is the tax exclusion? Why is it so important to healthcare? Well, every year when you're filling out your taxes, one of the things that's not included in your income is what your employer pays for your health insurance. You don't pay taxes on it. How did that come to be? Well, in September 1942, Congress passed the Stabilization Act. With all the young men going off to fight in the war, there was a shortage of labor. Wages were going up, prices were going up, and to restrain inflation, Congress wanted to put in wage and price controls. They limited the increase in wages, but there was an exception. The exception was that you did not consider health insurance as part of wages. This made health insurance an important tool for employers to attract workers into the workforce. Then, in 1954, Congress passed a law to revise the Internal Revenue Code. And it said that health insurance would not be taxed as income. It would be excluded from income and payroll taxes. That made $1 of health insurance worth more than $1 of wages, because the health insurance would not be subject to both income and payroll taxes. Over the years, the consequence is it increased employer-based insurance. But every year, the tax exclusion on health insurance takes away $250 billion of taxes. It is the single largest tax deduction in the American tax code. Not only that, it's also terribly regressive. That is, rich people get a bigger benefit from the tax exclusion than people with lower incomes. Why is that? Well, for one thing, the rich are likely to have bigger and more expensive health insurance. For another thing, they're likely to be in a higher tax bracket, and so they get more benefit, much more benefit, than a poor person. The tax exclusion is a very regressive tax. The healthcare reform team split on what to do about it. First, the economic team wanted to modify the tax exclusion. Not only was it taking a lot of money from Treasury, was it regressive, limiting the tax exclusion was a very effective method at cost control. The political team did not want to modify the tax exclusion because the President had run against John McCain, attacking John McCain's proposal to completely eliminate the tax exclusion. So David Axelrod, the President's chief political advisor, created a video montage of commercials that the President had run against McCain on the very issue of the tax exclusion. Let's look at one of them.
I'm Barack Obama, and I approve this message.
On health care, John McCain promises a tax credit. But here's what he won't tell you. McCain would impose a new tax on health benefits, taxing your health care for the first time ever. It's a multi-trillion-dollar tax hike, the largest middle-class tax increase in history. You won't find one word about it on his website, but the McCain tax could cost your family thousands. Can you afford it?
We're back in the second floor of the West Wing of the White House. I'm sitting right to the President's left. And as we move from pleasantries to substance, I mentioned to the President that modifying the tax exclusion is really important, not because it'll generate a lot of revenue, but because it'll have a big impact on cost control. And we begin to debate and discuss that. This course is about the Affordable Care Act and how it changes the American healthcare system and what it's going to do in the future. In week 1, we're going to explore how the Affordable Care Act was actually passed when previous legislation to reform the American healthcare system had been defeated for over 100 years. Week 2 begins to take apart what was in the Affordable Care Act, looking at the way access was expanded. Week 3 looks at how the Affordable Care Act is going to impact cost and quality. Week 4 looks at all those implementation problems, the problem with the rollout of the exchanges. And weeks 5 and 6 look deep into the future, 10 years into the future, and how the Affordable Care Act is going to redesign the American healthcare system. Well, we're going to try to understand how the Affordable Care Act is changing the American healthcare system, initially looking at that heroic effort to actually pass the bill. Back in the West Wing, we were discussing and debating with the President. What ended up happening to the tax exclusion? Did it get included in the Affordable Care Act? Tune in and find out as we go through the American system.